Lauren Miller-Rogan, Adriana Padilla.
Here.
Joe Panetta.
Here.
Al Rolette.
Here.
Oz Stewart.
Here.
Jonathan Thomas.
Here.
Art Torres.
Here.
And I believe Carol Watson is just joining now, so I will call her name in a moment.
You never called my name. Is there a reason?
You are actually, yes, no, that's fine. Shlomo Melmed. Are there, and Larry Goldstein, I think you joined as well.
He was on earlier.
Okay, great.
Yes, I'm here. Sorry, I'm muted.
Yes, thank you. Go ahead, JT.
Thank you, Maria. Okay, we'll go on to the action items. There are two action items here, and this is the Application Review Subcommittee portion of the meeting. I will be leading the first, and Oz will be leading the second. First is consideration of applications submitted in response to program announcement Bridges Education 2 RFA, and we'll have a presentation by Dr. Zambrano.
Okay, good morning, everybody. Thank you. Let me just put up the presentation. All right, so I'm going to give you an overview of the recommendations from the Grants Working Group regarding the CERN Bridges training program and a little background on the Bridges program itself, just as a reminder of what this is about. So among our pillars, in our education pillar, we have several types of programs focused on training that span from high school to postdoctoral and clinical fellows. The Bridges program in particular is focused on training undergraduate and master's level trainees. And this award was first implemented in 2009. So it's gone on for about 12 years, and we've had 16 different grant awards that have been issued for this program and has trained over 1,600 individuals. The objective of the Bridges training program is to prepare California's undergraduate and master's graduate students for productive careers in stem cell research and therapy development. And we've, of course, broadened that to regenerative medicine and gene therapy. And the way these programs are structured, they're integrated into existing bachelor's, master's, or certificate programs at the home institution throughout the state of California. And the programs provide opportunities to students in order to bridge them to research that might not be available at their own institution. So they participate in internships at host institutions that are conducting cutting edge research. So some of the features of the Bridges training program include coursework that's provided to the students, including a laboratory techniques course where they may learn advanced cell culture techniques, even how to culture human embryonic stem cells and other advanced techniques. They have patient engagement and community outreach activities, which allows them to engage with and get to know patients and patient advocates, as well as also engage in community outreach where they will make presentations to high schools or elementary schools, or participate in fairs to teach others about regenerative medicine and stem cell research. Of course, the main component is the paid research internships at the host institutions where they're conducting research, and those vary in overall time from about 8 months to a year. And then finally, there's the annual Bridges Conference, which is supported separately, but one that we provide funding for in order to bring all of the students together each year where they present the outcomes of their research internship in poster presentations, and they have the opportunity to hear presentations from other scientists as well. And so this is just some of the outcome and impact data that we've collected. So this is a little old. It's not the most recent. This was up through 2020. And so at the time we had about 1,500 alumni in those first 11 years. And we did a survey, as we occasionally do, in terms of just how they're doing. And we learned that about 48% of those survey responders are first generation college students, that greater than 60% become employed in R&D positions. So 53% are in academic labs, 47% in biotech or pharma. About 35% are in PhD professional or other graduate programs, including medical school. Many of them will decide to go into higher education. And overall, the activities of these students has contributed to 261 publications in scientific journals through the program. So those that may apply for a Bridges program are California universities or colleges that don't have a major stem cell research program. So the idea is to focus this program largely on the California state universities, some of the private universities and community colleges, and to bring opportunities into those institutions that will allow those students to be exposed to cutting edge research. So for this opportunity, the ICOC has approved up to $65 million to support up to 18 awards, with each award supporting up to 10 trainees per year. And each award would provide up to $3.6 million for a 5-year period. So that was the concept that was approved previously. There are some award priorities that are highlighted in Prop 14, and I just want to mention them, and I'll allude to these a little bit later when I show you the outcomes. Applications that offer matching funds or verified in-kind support, as well as applications that enhance the geographic distribution of the training and socioeconomic diversity are highlighted as elements that should be prioritized in these programs. The scoring system that was used by the grants working group to assess these was a range of 1 to 100, with scores of 85 to 100 being a recommendation to fund if funds are available. And the review criteria that were utilized in scoring the applications are based on the following 4 questions. Does the proposed program have the necessary significance and potential for impact? Is the training program well planned and designed? Is it practical and achievable? And do they have a track record and outcomes of prior training programs demonstrating success? And so this is just a table that summarizes the overall recommendations. There were 15 applications that were submitted and reviewed. 14 of them were recommended for funding, with a total applicant request for those 14 of about $48 million. The funds available, again, are $65 million, so well within the amount that is available. There was 1 application that was not recommended for funding, and the CIRM team's recommendation is to fund all those that are recommended, so the 14 with the score of 85 or greater. And let's see, so that is it for that. And let me just share excuse me, hold on a second. And I'm going to share the spreadsheet that shows the list of programs. And I want to just orient you just a little bit on this. So this is part of the cover sheet that was provided with the summaries. But here I'm also showing a couple of other things. The proposed match or in-kind support provided by each of these applicants, I'm showing you here. And as you can see, almost all of them provided some level of match or in-kind support. this isn't necessarily cash or funds. In many cases, this is a combination of either release time for their faculty, equipment that is provided, funds to support an 11th trainee in the program, things such as that. I'm also showing the California region for each of these applications, just to also show you the diversity of the regions, the geographic distribution that exists among all of these different programs, so that you can see that as well. With that, I'll turn it back to Chairman Thomas.
Thank you, Dr. Sombrano. First order of business here is, do we have any motions to move the Tier 2 proposal up into Tier 1?
JD, I have a question, not a motion. Is that the right time or not?
Well, I think if somebody wants to make a motion to move that up, we could have the question then, or why don't you just go ahead, Anne-Marie?
Okay. Gil, thank you very much for an excellent presentation, as always. We did read the email or the letter from an appeal letter from, I believe, that particular site. Can you make any comment about why this site stood out as not recommended for funding, and the comments particularly on their appeal letter? Thank you.
Sure. I mean, I can comment to the extent possible. So the applicant is, as you noted, the one that was not recommended for funding. And there were several reasons why this application stood out. And part of it is, you know, the program had a proposal to create opportunities for trainees, but they weren't fully articulated or fleshed out. And so I think relative to the other programs, it's the one that seemed to have less detail and a formal structure to it. I think one of the things that stood out was the self-placement of the students into the internships. Although, as noted by the applicant, it isn't, you know, fully self-placement of the trainees, but it is unusual in that a lot of the activity is left to the trainee to find the laboratory where they're going to do the internship. And there was, I think, hesitation or fear from reviewers that this might not be the best approach to placing students in those internships. So I think it was a combination of those things that gave reviewers pause in the program. The other thing that I will note is that all the ones that are recommended have had a recent Bridges training program. In other words, they're basically renewing the program that is currently active. This one that was not recommended did have one previously. When we first started the Bridges program, they competed in a renewal for it, did not get it, and so they have in funding that program because of that. So they have not been up to speed in terms of having an active program, if that makes sense.
Okay, I'm for the sake of argument here, I'm going to, for a variety of reasons, move that we move this application up to Tier 1, which I will explain if we have a second to that effect.
I second.
Thank you, Isabel. So yes, so I'll open the comments here. So in reading the director's appeal letter, to me, I found it quite persuasive. It acknowledges, it answers a number of the issues that Dr. Sombrano has articulated. Did note that the self-selection process actually worked, in her opinion, well in the previous iteration. But one of the things that was most notable about this letter was it acknowledged some very helpful suggestions from the GWG that would be incorporated to make this program an even better program than it was to begin with, which I found to be a refreshing approach, since a lot of times in appeal letters, it's always about how the GWG has it wrong or whatever. There was a real effort here to take to heart what was said. This, as you can see on the scoring, this got an 80. This isn't something that was down in the 50 range. It was quite close to the recommended for funding level. I think that having Berkeley represented in the program would be a very positive thing, obviously being a very important center of learning. And then if you go to the second letter written by one of the previous students, and you read his story and his articulation of what's happened to others from his particular class, that's exactly what you'd want to see from this terrific program. And I do want to give a shout out here to Art as being the one who brought this to CERN, the idea back many years ago. But his story is precisely what you want to see coming out of this. And so I for all of these reasons, I find the appeals persuasive, and I would support moving this up to tier 1. Are there other comments from members of the board?
JT, Isabel
I
here?
see Al has his hand raised. Sorry, Isabel.
Okay, that's okay.
Al first, then Isabel. Al.
I should be a good student.
Thanks, Isabel.
Not a problem.
So
Al,
as a participant in this particular application, without talking about the specifics associated with my score, I want to make sure that members of the board appreciate that, one, this being a community college was not a deterrent from my perspective in the application whatsoever. And in fact, as I looked at it initially, I was more inclined because it was a community college. Second, if you look at the range of scores for the day, they were overwhelmingly positive. It would have probably been a different outcome, although I can't predict what will happen with certainty, had they included some of the key points that were included in the letters that were submitted. And that's the reality. And that's part of the reason why this was scored the way it was. I probably in all likelihood will vote to support JT's notion of moving it up. But again, wanted to make sure that people appreciated that.
Great, thank you. Let's go have Isabel, then Anne Marie, then Fred, then Oz.
Thank you, JT, and I appreciate Al referring to the letter that was written vis-a-vis the grant proposal. I was thinking that, like me, they probably need a better grant writer. But I really appreciate, in fact, that this is a city college, that 3/4 of its students are people of color, that this president and this biology advocate, the program director from biotechnology, are passionate about making sure that their students have these opportunities, even though they don't go to some of the high named colleges and well-funded and or well understood colleges. I'm just really thinking that this is exactly where we need to start creating those pathways to research success by allowing, encouraging, embracing these kinds of city college opportunities for kids who might normally not feel secure, not get entry into the major colleges, to test their understanding, love, and ability to manage science. And I didn't even like cutting up frogs. Who was to say I was going to end up on the other side of this trying to figure out stem cells? So I just think that I would give them every opportunity to bring their program up to snuff, which they want to do. And I would also recommend that perhaps we give them a helping hand by perhaps connecting them so they can leverage their learning with some of the others who might mentor them and help them understand how to put well. they are talking about developing and learning best practices. And I think that this is truly a learning curve for them as well. I'm so glad you moved this up, JT. I want to see this group succeed.
Thank you, Isabel. Anne-Marie.
Yeah, briefly, Isabel, I completely agree with all your comments. Question to Gil, JT, and others. Should we be influenced in our vote by the fact that this is in probably a socioeconomic underprivileged area, the Berkeley, Oakland, and that we should facilitate, as a pledge to diversity, we should facilitate access to training, particularly in these underprivileged areas in California? Should that influence our judgment?
Yes, yes, absolutely, in my
I think so.
opinion. Yeah. Gil, do you want to comment on that?
No, I really don't have any other comment. As I mentioned earlier, the socioeconomic diversity is an element that should be considered, which is in part why we put this California region element in there as well.
Right. Okay. Thank you. Fred.
So, new to this whole thing, and my experience thus far has been about CIRM advancing great science. But now I have come to understand, after reviewing all the materials, that CIRM is also a capacity builder. And it's done that in different ways. It's provided enormous funding to build the capacity, building infrastructure at major institutions, which has shown great results. And I was more moved by the letters from the students that have been through the program as evidence of capacity building, that the outcomes of those students really seem to be in line with what CIRM's objectives are in through this funding channel. And building capacity by incubating the interest of potential great scientists early in their academic life. If that's what we're trying to achieve, then those letters seem to suggest CIRM had been achieving that through this institution. And if there are things that we can do to help them continue in that way, then it seems like a worthy investment.
Thank you, Fred. Very well said. I 100% agree with you. Oz.
Yeah, thanks. Just to pick up actually on the very last thing that Fred said, I am going to vote in favor of this, but I would like to suggest a friendly amendment, if I may. And let me explain the purpose of that. I think well, first of all, the grants working group always reads every grant in the greatest detail and takes incredible time looking at the strengths and weaknesses. And they did find weaknesses here, which they pointed out and that Gil has already talked about. And that main weakness was the letting things happen in terms of trainee finding an advisor in a fairly uncontrolled way. I think that actually is an even more important weakness for exactly the reasons that Isabel and others have talked about here, because this is not a training environment where there's a structured form. And so I think that there is a chance of students quickly getting lost and losing their way in engaging. Now, I think there's a very easy solution here, and that's what my friendly amendment is. And that is to recommend approval with the proviso or caveat or whatever, that the program provide an interim report at the end of the year on student success. The individual letters were very impressive, but we don't really have a feeling for how many students might have been lost in previous programs. I prefer to see actual data rather than attestations. I think that's a word. So my friendly amendment would read something like this. Approve with the proviso that the program develop a successful mentoring advisee system that can be documented to be successful by the end of the first year. Something along those lines. And whatever the words are, that's the gist of what I'm suggesting. Thank you.
Okay, thank you, Oz. I'm fully amenable to that that friendly amendment. Isabel, is that okay with you as the seconding party?
Yes, I like the idea of what he's talking about for the interim report and for them to strengthen some of the weaknesses in the program. But when I talked also about mentee, I'm talking about cross these systems. Maybe they should work with San Francisco City College, which seems to have, figured out a winning formula. And I think they're also funded here or being recommended for funding. And I thought I saw their name on here. Or some other group where they can actually, cross-pollinate their students and learn from each other and learn best practices and so on and so forth. So that might be just a program idea as opposed to part of a friendly amendment.
Mm-hmm.
Okay, are there other comments by members of the, Fred?
So is it appropriate for CIRM to actually prescribe the process, or are we comfortable leaving it to each institution to figure out how best they should be stewarding their students? Because I think the issue and the amendment that Oz proposes makes sense, and then Isabel's comments suggest maybe there's a need for standardization in terms of how this program channel gets executed at the site level, and those become prerequisites for funding, is meeting those standards or what we'd want to see in terms of that.
Oz?
So as a direct answer to your question, Fred, yes, I think that CIRM does have the ability and authority and actually responsibility to require certain things. We do for our research grants, things that sometimes are uncomfortable for the investigators at first. And I totally appreciate and agree that the characteristics of a program really depend on the situations at the institutional level. And I'm not prescribing here. I'm not saying that we're going to demand a particular thing. I'm proposing that we require them to show that their choice of thing actually worked at the end of the year. That's all. And if it didn't, if they're losing students or students are having a hard time, then I think that there needs to be a very, very rapid adjustment so that this program can succeed, because it really, I think, is an important program, but we don't want to have the students get lost. Thank you.
Thank you, Fred, and thank you, Oz. There are other comments from members of the board.
Yes, JT, it's Art. I don't think I can opine on the project because I'm conflicted.
Art, you cannot comment on this.
Which is what I just said, Maria. I cannot comment. But I can comment about what the Board of Regents is going to be considering tomorrow, which lends itself to what Isabel and others have been talking about. And that is, we're not the only ones that are concerned about diversity. 45% of the prospective freshmen of 132,000, the largest class ever admitted to the University of California, were low income. 45% were the first in their families to attend a four-year institution. And the campuses also admitted the largest amount, 28,000, from the community college level. So clearly our university is moving in the right direction. Do we have a lot of more work to do? Yes, especially when only 5% of the applicants admitted were African-American. We're still woefully behind in that arena, but at least we see some increase in the Latinos to 37%. So diversity is improving, and especially making sure that recruitment, as Isabel was concerned about, as I have been as well, that we recruit these young people, especially diverse students, into the science field and into the graduate field, and hopefully into the academic and institutional field as well. That was what I wanted to report.
Okay, thank you, Art. Other comments from members of the board? Okay, we have a motion with a friendly,
JT, hang on, Isabel again.
yes.
Not trying to be rude, but I was waiting for others in case they wanted to speak. I simply wanted to add to Art's comment. I think it is really crucial to understand that sometimes the challenges for these students of color coming out have double and triple responsibilities on their hands. They're working part-time to help their families. There are a lot of other challenges. Sometimes they don't even trust their own abilities to take on something like science. And I think that being in these small kinds of colleges that can maybe nurture those hopes and dreams and, show them that it's okay to fail. It's just another learning opportunity. So I like the idea of supporting these, the community colleges where kids can learn to trust themselves and believe in themselves and then take on the giants. So I want us never to, I want us to help these small colleges be best so that they can in fact nurture this next generation of scientists that we're hoping will be there.
Okay, thanks, Isabel. And I would refer everybody to the letter by the former student, which gets exactly to that point about how well it prepared him and many of his colleagues for taking on the world, which is exactly what we hope happens in this program. Okay, so we have a motion with a friendly amendment on the table. Kevin, do you have the phrasing for the friendly amendment so that we know exactly what is being moved at this point?
Yeah, we were trying to capture it here on our side. And we believe the amendment is, sorry, I'm trying to read Maria's writing as we were going back and forth. That Oz proposed that the program develop a documented successful mentorship program within the first year. So that was the condition upon which, so he would add that, I believe, Oz, to the original motion. So it's approval with the condition that the program develop a documented successful mentorship program within the first year.
Yes, correct.
And report back, correct, Oz?
Well, and consider this a milestone. It's the same kind of thing that we do in research grants and clinical grants and so forth. This would be considered their milestone for continuation of funding during this period of time. And I'm not suggesting that this come back to the board or to the grants working group. This is something that I'm suggesting that they do in conjunction with CIRM staff, and that CIRM staff review whatever they put together and that CIRM staff make that decision of whether the program actually meets the goal. I'm not setting a particular threshold here, but again, we want to help them succeed. And as Isabel said, these are students who may not feel confident in themselves and may need extra help here. So I think that this is really a way of ensuring that. Thank you.
Okay.
JT, I believe the wording provides flexibility on the part of the CIRM staff to determine the level of documentation and the determination of success, if that's okay with you and the board.
Sure. Okay, great. All right, so we have a motion as amended and a second. We have no further board comment. Do we have public comment on this motion?
We do have public comment, JT.
Okay.
I think Barbara would be the first one. So if you could unmute yourself. And you have 3 minutes for public comment.
Well, I'm not going to, I planned my public comments right to 3 minutes, but I'm not going to say them because all of you have expressed very clearly and thoughtfully just what I was going to say. So I think I'm going to leave it at that. But I do want you to know that our goal in our classes has always been to help students gain confidence. This is the most critical factor that we found. And it goes a long way to ensuring their success. And our students have been successful. I have written down your suggestions and regarding standardizing the on-ramp of students, and we will take that seriously. I did want to say that our students were given quite a bit of support during the process in the first SERM internship, and we didn't really lose any students. We're very well aware of that lack of confidence. And one of the things we try to do throughout our classes, our lab classes, is expose students to so much that they build that confidence in themselves. And that's so critical to us. But I do want to thank you very much for your comments. And I would, if we are funded, we will definitely work with the City College of San Francisco, as they do have a nice process there. But basically, I just want to thank you for your thoughts. I feel that we have a very strong program. And in fact, given the training that we afford, we really do offer the breadth and depth of training that I think is critical for successful SERM internships. So thank you very much. And I will allow the extra time for my students that have wanted to join. Thank you.
Barbara, could you just give your full name and title for everybody, just so they know exactly who you are?
My name is Barbara Desrochers, and I'm the Program Director for Biotechnology at Berkeley City College. And I think most of you probably know that Berkeley City College is part of the Peralta Community College District, which includes 4 colleges that serve the East Bay. And we're really the only college that offers this level of a biotechnology training in the East Bay, in the community college system.
Okay, thank you very much for your comments. Next, Brian, if you could give your full name and affiliation, please.
Hello, my name is Brian Siemens. I am a staff research associate at the University of California, Berkeley. I was a 2015 CERM Bridges awardee. I would like to kind of add to the whole selecting of your lab. I did find it kind of enjoyable and a sense of establishing confidence to explore different laboratories for my own. I reached out to PIs, I interned with them, I kind of reviewed who I want to join. And I thought that that was kind of maybe a problem. And I agree with you guys that it would be good to kind of relay this information back. But it was a very enjoyable program. You may think like a city college doesn't have much to offer, but Berkeley City College has one of the most advanced scientific laboratories that I've ever seen. I'm working at UC Berkeley, and I'm also working for a startup here in the Stanley Hall QB3 garage, all thanks to CERM. So I was doing my 10-month internship in Kevin Healy's lab at UC Berkeley, using stem cell iPS-derived cardiomyocytes that I differentiated in his lab. I've always been told I'm so excellently trained. Every postdoc I've worked with and grad students, I've actually trained postdocs and grad students, all thanks to this program. I would just like to express that Berkeley City College is really one of the most advanced programs that there is to offer for a city college. And I just really would like to have it reconsidered. Obviously, not everybody has the ability to get into a university. I myself am one of these included there. And I found this program at Berkeley City College, and I changed my nursing career to go into this route. And I knew nothing of laboratory techniques or anything, and it very well prepared me for what was to come. I succeeded in my 10-month internship. I published a paper in stem cell. It's actually a new Nature communication or Nature stem cell bioengineering paper when I was doing my internship here. Since then, I've published, co-authored with numerous publications with Kevin's lab, with UCSF collaborators, advancing the drug discovery pipeline with our cardiac chip. I think Berkeley City College is precisely where this kind of investment needs to be pushed to. And I think, like Barbara said, you guys have addressed a lot of your kind of concerns with the program, the way it was kind of structured. But I do think that's a simple thing that we can correct, because we have many collaborators that they have access to. They have the different equipment and everything needed to really push the boundaries for people that aren't really, getting into these systems, right? Like a lot of young kids, new kids, older people, they changed their career path midlife or something like this, like myself, and it may be kind of difficult to get into a university. Most of these applications are pretty advanced, and you don't really see unless you get into a university or a startup or something in industry. And I think a lot of these kind of underrepresented people would really benefit from keeping this program active at Berkeley City College.
Okay, thank you very much, Brian. And we know that your comment about we may not think that community colleges have great setup. We are fully aware that the community colleges have tremendous programs. We are 150% in support of all that they do. And it's very good to hear about your personal experience there as indicative of the strength of the program and exactly what you were able to learn. So thank you. Jason, next, please. Your name and affiliation first.
Hello. My name is Jason, and I am also a CERN Bridges student. I was actually in the class with Brian. I would like to speak on behalf of BCC in that I'm an unconventional student. I came to BCC after my time in the Marine Corps, and I was able to come into a class that was filled with a diverse group of students. Some had children, some were working full-time, some part-time. Some people were on their track to go to medical school, nursing school. Myself, I had ambitions of doing an engineering program at Berkeley. And I felt that the program, the biotech program, was perfect. It trained me. The labs were excellent. I got a lot of personal attention. The teachers were passionate. And not only was I able to use my GI Bill to attain the mechanical engineering degree that I wanted, I was actually able to walk away with a biotech and an AS in biotech, which served me greatly. With the events that we've all been experienced this past year with the COVID, the only jobs that were actually not affected was the biotech industry. So as I graduated in 2020 and people were wondering how long was it going to take to find a job, I was able to rely on my biotechnology degree and find a job almost immediately. So now I'm able to build both skill sets simultaneously, one with the engineering degree, the other with the biotech degree. And that is because of the CERN Bridges program at BCC. I considered other schools in the area, and after visiting their campuses, it just wasn't for me. Either the schools were too large, such as City College of San Francisco wasn't a great fit for me, mainly because the campus was so large. I went to visit BCC. The labs were, it was night and day. One looked like, I would compare it to maybe like a high school setup from the 90s. And the Berkeley setup was more in line with what I wanted to do in terms of preparing me for the industry. As far as the self-selection, in terms of being able to pick your lab, I think that's great. I think it prepared me in terms of no one told me which way to go. I wanted to go to Berkeley. So instead of some of my other, classmates were interested in industry. So while they were looking for internships in industry, I was able to go to Berkeley and pick 3 different labs and go on interviews with 3 different PIs. I'm sorry, my time's up. But essentially, it gave me the confidence because nobody's handed me a job after my graduation. I had to go out on interviews. So that being able to select my internship, it gave me the confidence to get out there and, earn my keep.
Great. Thank you very much, Jason. Any other public comment? Okay, hearing none. Maria, will you please call the roll?
Dan Bernal,
Aye.
Anne Marie Dulage,
Aye.
Isabel Duon,
Aye.
Mark Fisher Colbury,
Yes.
Fred Fisher,
Aye.
David Higgins,
Yes.
Steve Julesgard,
Yes.
Dave Martin, Lauren Miller Rogan, Adriana Padilla,
Yes.
Joe Panetta,
Yes.
Al Rolette,
Yes.
Stewart,
Yes.
Jonathan Thomas,
Yes.
Carol Watson. Carol, you're on mute. Motion carries.
Thank you, Maria. Okay, so that will now elevate that application to tier 1. The next step in this process, do we have any motions to lower any of the tier 1 projects to tier 2? Hearing none, do we have now an omnibus motion to approve the slate of 15 grants listed on your screen?
So moved. This is Al Rolette.
Thank you, Al. Do we have a second?
And David, San Diego.
Thank you, David. Comments from members of the board? Or any comments from members of the public? Hearing none, Maria, will you please call the roll?
Sure, and as a reminder, I would ask board members to answer with yay or nay, except for those with which I have a conflict. Dan Bernal,
Yay.
Leandra Clark Harvey, Anne Marie Dulege,
Yes.
Isabel Dudon,
Yay.
Mark Fisher Colry,
Yay.
Fred Fisher,
Yay.
David Higgins,
Yippee yay.
Steve Julesgaard,
Yes.
Dave Martin, Christine Miaskowski,
Yes, except for those with which I have a conflict.
Lauren Miller Rogan, Adriana Padilla,
Yes.
Joe Panetta,
Yes.
Al Rolette,
15 yays.
Stewart,
Yes, except for those with which I have a conflict.
Jonathan Thomas,
Yes.
Art Torres,
Aye, except for those with which I have a conflict.
Carol Watson.
Yes, except for those for which I have a conflict.
Thank you very much. The motion carries.
Thank you. Congratulations to all 15 applicants. We, as always, avidly look forward to hearing about how your programs proceed and wish you the best of luck. Okay, now I'm going to turn this over to Oz for number 4, consideration of applications submitted in response to clinical trial stage project program announcements. Oz.
Thank you, JT. And I will immediately turn it over to Gil for a presentation on this application.
Okay, thank you very much. Let me just share that. Application submitted to the clinical program. And as you may recall, the clinical stage program offers 3 different types of opportunities. Those for IND enabling work, which is the CLIN 1, and for clinical trial work, which is the CLIN 2, as well as supplemental accelerating activities, which is the CLIN 3. So this particular application we're considering today is a clinical trial that falls under the CLIN 2 program. And more specifically, it falls under our allocation for sickle cell disease under our collaboration with the national, with the NIH and HLBI. And so there is an allocation that was made for that partnership of $30 million. And so what I'm showing you here is the amount requested today for this particular application is 8.4 million. We have approved already 12.6 previously, which would leave 9 million in that allocation remaining. The review criteria that were utilized for assessing this project, along with other clinical trial stage projects, fall across these 5 questions. Does the project hold the necessary significance and potential for impact? Is the rationale sound? Is the project well planned and designed? Is it feasible, including the overall team and resources available to the project? And then finally, does the project address the needs of underserved communities? The scoring system that is used based on those criteria is one of a 1, 2, or a 3. Those that receive a score of 1 means that they have exceptional merit and warrant funding. They might have some minor recommendations or adjustments, but otherwise don't need further review by the grants working group. Score of 2 means it needs improvement, and these applicants get the opportunity to revise their application before returning to the grants working group, or a score of 3 where it is sufficiently flawed that it doesn't warrant funding at this time. There are a couple of elements in the CIRM application review that I just wanted to mention. I already did mention the addressing needs of underserved communities. And this section is the applicant's plan for outreach and enrollment of a diverse patient cohort that accounts for racial, ethnic, and gender diversity in the clinical trial. And so this element is one that's reviewed by the scientific members as well as patient advocate members, but is incorporated into the score of 1, 2, or 3. So that element, as mentioned, is part of the review criteria. We have also been reviewing and discussing diversity, equity, and inclusion more broadly. And this is a more holistic view in which the applicant team incorporates, or an explanation of how the applicant team incorporates diverse perspective and experience in order to improve the project, and also bring, a mention of how they value diversity and what the team overall does to broaden it. And so this section is evaluated and scored by our patient advocate nurse members of the board, and is shown in the DEI score, which is in a range of 0 to 10. So this particular application is CLIN 2 SCD 11722, which is a cell and gene therapy for sickle cell disease. It is a CD34 positive hematopoietic stem cell product that is genetically modified to correct the sickle cell mutation. So this is autologous cells, so cells from the patient that are corrected for that point mutation. The indication is for individuals that experience severe sickle cell disease, and the goal is to complete a phase 1 trial to assess the safety and initial efficacy of this product. The total funds, or the total cost of the project, is about $16.8 million, and this is expected to be shared equally by CIRM and NHLBI, and each contributing about $8.4 million to the award. And I'll speak more about this. The NHLBI contribution is still pending final approval, and I will reference that in just a second. Oops. Here. So a little background on sickle cell disease. The sickle cell disease affects approximately 100,000 Americans. It is particularly common among those with sub-Saharan African ancestry, affecting 1 in 365 African American births. Globally, there are over 300,000 babies who are born with sickle cell disease each year. So what is the value proposition for this proposed therapy? The only current cure is an allogeneic hematopoietic stem cell transplantation, but donor availability is quite limited, and there's a high risk of complications such as graft versus host disease that patients can experience. So the proposed autologous therapy, being autologous, would avoid the medical risks of an allogeneic transplant, and because it aims to correct the genetic mutation, it may also provide a potential cure. This is a stem cell project because the therapeutic candidate includes hematopoietic stem cells. This slide gives you an overview of some of the projects that we have active in our portfolio at the clinical stage. So we are supporting quite a few projects that seek to help with or address sickle cell disease in some way. There's a mixture of both autologous and allogeneic approaches. The first one listed is actually the precursor to this particular grant application. This supported the IND enabling work, and this particular application now seeks to start the phase 1 clinical trial. This slide is a summary of previous CIRM funding to that applicant. So included in this is the IND enabling award, which is just ending. They have been successful in achieving the milestones and filing the IND, which has permitted them to get to this stage. They also had a translational award that helped develop the product that is that would be studied under this clinical trial. So finally, this is the recommendation from the grants working group. There were 12 members who gave this a score of 1, 3 that gave it a score of 2. So the overall recommendation is that of a 1 to fund this. The DEI score was an 8 on a scale of 1 to 10. And the CIRM team's recommendation is to fund this application in alignment with the grants working group recommendation. And so I will note here again that the award amount that you would be approving from CIRM is about 8.4 million. And we are expecting NHLBI to contribute an equal amount, but is pending final approval. They've already gone through their own scientific review and assessment, which has all been fine. So this is what we expect to be just a final sign off to happen within the next few days or weeks. One note is that your approval will be contingent upon that NHLBI final approval. And we will not initiate the launch of the award until that co-funding decision is confirmed. Excuse me. And if for some reason NHLBI does not meet that co-funding contribution, we will require the applicant to secure co-funding of those project costs before bringing it to you for a final approval if that should happen. So that is the presentation. Back to you, Dr. Stewart.
Thank you, Gil. Just to sort of say something before we start the consideration, as someone who's been on the ICOC from the beginning, I'll just say, this is the image of what we all thought might be possible back in the beginning. A project that meets a clear unmet medical need, that moves through funding of different stages of research, the wonderful actually continuum of research programs that CIRM put together, which is unique amongst funding agencies, all the way from early discovery through translation to the initial grants that we're the clinical grants that we were seeing and reviewing now. So it just I just have to say it's just so great to see. With that background, I'll open the floor and ask if there is a motion to fund this proposal. Thank you.
So moved. This is Al Rolat.
Second, this is Dan Bernal.
Thank you. Discussion by the board. Maria, do we see any?
And Anne Marie has her hand raised.
Ah, sorry, I can't see it.
Just a
Okay,
question,
Anne Marie.
I appreciate the quality of the grant. My only question is, how much total funding have we devoted to this important disease? And is it somewhat disproportionate to the amount of funding that we might, can, should devote to other equally important diseases?
So before turning that question over to CIRM, let me just say that the board actually allocated the amount that we did based on a vote by the board, and we've also voted for the co-funding arrangement that we currently have. So this whole thing was in fact something that was considered in actually quite a lot of detail by the board. But I'll turn it over to CIRM staff in terms of the actual numbers.
So the actual numbers, if this is approved, out of the 30 million that was allocated, would mean an investment of about 21 million. But as mentioned, there were other awards that we have funded that have not necessarily been in collaboration with NHLBI. I don't have the total investment number of all of those, but it would certainly exceed the $30 million amount in total.
Thank you.
See a hand from Fred.
As a non-scientist, you'll get used to me prefacing my remarks with that. I'm curious about the three that ranked it as a 2, and in scanning the remarks, there were concerns about engraftment, which I have no idea what that is, and there were concerns about the endpoints of the trial. So I'm wondering if someone can address those concerns and why we ought not to be concerned about that in approving the funding, if that's a reasonable question.
Oh, it's a very reasonable question. Thank you, Fred, and I'll turn that over to Gil.
Yes, thank you for the question. So the engraftment is the ability of the transplant or these hematopoietic stem cells to stay in the bone marrow and then give rise to the cells they hope to. And so the question and our concern is that it may not work. In other words, if they do the transplant, there's the possibility or the risk that ultimately that patient will not experience the benefit of a cure by having those cells engraft into the bone marrow. And this comes from just preliminary data that in mice gave the reviewers some concern that could be the case. The applicants, however, have made, I think, a pretty reasonable argument for why they believe it will. And I think ultimately where reviewers landed in the consideration of all this was that you really won't know until you do the trial and see it in the patients. And so, there is the risk with a lot of these studies that they may or may not work. And so that was one of the concerns with the engraftment. There were some concerns related to potential safety, and that arose through issues on different trials where some of those were temporarily halted because of malignancies that seem to have occurred with similar approaches in sickle cell disease patients. The reason for that is not fully understood. Since that time, the hold on on those projects has been, for the most part, released, and so the FDA is now allowing these trials to go forward. But here again, this is one of those elements that is now being incorporated in terms of being cautious about the screening of patients that first go into this trial, as well as ongoing monitoring of the patients for any potential risk of malignancy or any occurrence of malignancy as they go through this trial.
And the concern about endpoints that was expressed by one reviewer, that the feedback regarding endpoint definition wasn't responded to. Are we clear about what the endpoints are?
Yeah, so I think that was a kind of a cleanup comment because they expressed it slightly differently in different places in the proposal. But this is clearly a safety trial where the endpoint is really about testing this product and enrolling 3 adults to see if they experience any adverse events. So it really is focused on safety.
Thank you. I see Larry has a hand up.
Yes, thank you. So I want to give a partial response to Anne Marie's question about perhaps an outsized investment relative to the frequency of the disease. And I'll just point out for Anne Marie and for the public who may not be well informed on this point, the medical community often develops therapies for rare diseases. And part of the reason for that is that they often provide a good technology platform that can then be broadened out to more common diseases in the public at large. Sickle cell is a particularly good target in that context because it's a well-defined disease genetically. There are a variety of technology platform approaches that are being tested for this type of disorder. And I think we'll see that one of them may eventually become the standard, not just for sickle cell disease, but for more common disorders that are perhaps less well defined in the general category of common disease.
Thank you, Larry. Other comments from board members? I don't see anything. Maria, do you have any hands up?
Nope.
Okay, then comments from the public.
There are no comments from the public that I see.
Okay, terrific. Then we'll pass it to you, Maria, for call of the roll.
Dan Bernal,
Yay.
Anne-Marie Dulege,
Yes.
Mark Fisher Colbury,
Yay.
Fred Fisher,
Yay.
David Higgins,
Yay. Yippee. Good. Wonderful.
Steve Julesgaard,
Yes.
Dave Martin, Adriana Padilla,
Yes.
Joe Panetta,
Yes.
Al Rolette,
Yes.
Stewart,
As my last official vote on the ICOC, I cannot fail to follow Maria's instructions and say, yay.
Jonathan Thomas.
Yes.
The motion carries.
Okay, well, thank you, Maria. Thank you, Oz. I had one comment, if I might. I was remiss in forgetting to say something in the context of our bridges discussion, which is just this last week, we had a fantastic annual Bridges Conference that was put together and expertly designed by Dr. Kelly Shepard. And I wanted to give Kelly a shout out. The conference, as always, was a great combination of PI talks, of student posters, which I might add are when things get back to normal, whenever that is, I would strongly recommend to all of you at the annual conference that Bridges holds in July to try to go to that conference, to see these posters, to hear the projects that the students have put together. It's so impressive. We're also a great panel with patient advocates as well as Bridges alumni. Just all in all, a terrific two-day event. So Kelly, thank you very much for your hard work in running that as well as our other educational programs. Before I get to my very last comment, I must give credit where credit is due. This is directed to Mr. Julesgaard and Mr. Rolette, that we've got the Giants took the first of 7 games in the next 10 days from the Dodgers last night. I am not happy, but being a stand-up guy, I wanted to congratulate you on that, and we will see where that goes from here. My final comment, in case you were wondering what,
Yay.
Yeah, that wasn't calling for a vote, Al. Thank you. If you're wondering what Oz just mentioned, this is sort of a happy but bittersweet announcement at the same time. So all of us on the board know we have term limits. Oz has been one of our original board members from inception and has been invaluable in the extreme in many different capacities. His time on the board is officially up. The governor yesterday, or a couple days ago, formally sent a letter to Maria nominating his successor, who is Rich Lahara, whom we will introduce to you at a future meeting to hear about his amazing story. But for the meantime, in having his appointment made, that means that Oz's tenure on the ICOC is coming to an end shortly. At our larger meeting in October, we will properly vet and acknowledge all of Oz's major contributions. But I just wanted to let everybody know that that is where we are. And so rather than get into what would be a very lengthy, embarrassing session for Oz here, impromptu, we will hold that till October. And just to say that as a summary statement, Oz, there's no way to repay you for all that you've done for CIRM, for the patients of California, for the voters of California who enabled this great grand experiment that is CIRM. And we will properly take that up and see you in October.
Thank you. I will reserve any comments, and which, by the way, will also embarrass some people on this call. Why is Maria laughing?
I hope you embarrass Maria. That's
no. Mr. Chairman, I just want to add what a challenge it was to find someone who could replace, not that he can be replaced, Oz on this board. And I'll reserve my comments for the later FET that we will honor him at. But I just want to say initially that, and will later as well, that I really have enjoyed my relationship with Oz. He has the best recommendations for Mexican restaurants in Irvine and Laguna. And in addition to that, he's just a tremendously committed professional. But I know he's proud in the fact that the person who will replace him was our first recipient of a stem cell transplant for a spinal cord injury. So it's going to be an interesting change, but nobody can replace my buddy Oz.
Thank you, Art, very much. Much appreciated. And as I said, much more to be said in October.
Absolutely.
And Oz, I would only say that I can't wait for this session where we will embarrass each other. But no matter what, we already miss you. That's done. That's up.
Thank you.
Okay, so we will withhold all further comment on that subject till October. Maria, when is the next meeting of the Application Review Subcommittee?
It's in August, I believe, the 24th from 10 to 12.
Okay, great. Well, thank you guys for a very productive session as always. And with that, we stand adjourned.
Ciao.
Thank you. Bye-bye, everybody.